We're sick and tired of the government ignoring our pleas, ignoring our demands, forgetting Western Sydney and forgetting the communities that we service, and knowingly putting our patients at risk by not giving us the ratios that we have been asking for over 10 years.
On the floor!
The nurses and midwives here today are clearly demonstrating to the state government that our systems are not coping in these hospitals. We need for the government to implement ratios shift by shift right now.
You're walking into chaos pretty much every single day. You have, majority of the time over 100 people waiting in the ED.
If you're an inpatient, you could be sitting in the waiting room for 18 to 20 hours until a bed is allocated for you to come into the department.
What's happening in the department is not safe. Perrottet, it's time for you to step up and make some changes.
I work mainly in the waiting room and in triage. Most of the time we are -5, 6, 7 staff, so that leaves one nurse out the front to up to 40 patients some days.
We've been severely understaffed. This is something that's not just hit us during the COVID period. It's just been highlighted because of COVID that we are understaffed and need more support.
It's pretty dire. You may have juniors or new grads with a nursing assistant looking after 8 or 9 people. And then the nurses get burnt out. They're doing too much overtime.
We've had 7 staff leave in the last 2 months. They're done. They've been pushed too far, they've got PTSD, they're burnt out, they can earn more money elsewhere with less stress.
Should we be satisfied that there are patients being treated in corridors? No! Should we be satisfied that there are heart attacks and strokes suspected in the waiting room?
No! The surge of presentations to the department has been overwhelming. That is the reason why when we run out of clinical spaces, doctors and nurses are treating patients on top of these commission beds along the corridors or even in the waiting room.
People should be able to access quality health care. They should not have to wait hours and hours for treatment in emergency departments.
Please, we're begging you, let us give the best care for our patients.
I'd like to see transparent actions and solutions to the current access and bed block problem.
Please listen to the nurses that work this every day. Let's start with our ratios and let's build something better.
Give us the ratios. That's all we want.